The World's Deadliest Cancers, a Global Health Crisis Still Unfolding. By Azlan Adnan, M.A. Despite rapid advances in cancer detection, treatment, and prevention over the past 2 decades, cancer remains one of the world's leading causes of death. At the top of this grim hierarchy is lung cancer, the deadliest malignancy on the planet, claiming more lives each year than breast, prostate, and colorectal cancers combined. According to the latest data from the World Health Organization, WHO, and the Global Cancer Observatory, GLOBOCAN, lung cancer alone is responsible for approximately 1.8 million deaths annually. Its lethality stems from several factors. It is frequently diagnosed at an advanced stage, has a high potential for metastasis, and remains deeply associated with tobacco use and, increasingly, with air pollution and genetic mutations such as EGFR in non-smokers. But lung cancer is only part of a broader picture. The following are the top 10 deadliest cancers globally, ranked by total annual deaths. 1. Lung cancer. With around 1.8 million deaths each year, lung cancer leads all forms of cancer mortality. Non-small cell lung cancer, NSCLC, constitutes the majority of cases, with growing concern over its incidence among non-smokers, particularly women in East Asia. 2. Colorectal bowel cancer. Responsible for approximately 935,000 deaths annually, bowel cancer is a major global burden. It is one of the most preventable and treatable cancers if caught early, yet late diagnosis remains a stubborn challenge. 3. Liver cancer. Claiming roughly 830,000 lives each year, liver cancer is prevalent in regions where hepatitis B and C are endemic. Chronic alcohol use and dietary aflatoxin exposure are also key contributors. 4. Stomach, gastric cancer. With around 770,000 annual deaths, stomach cancer is especially common in East Asia and Latin America. Helicobacter pylori infection is a major risk factor, though declining infection rates have begun to reduce incidence in some countries. 5. Breast cancer. The most commonly diagnosed cancer in women, breast cancer still causes 685,000 deaths per year. Despite higher survival rates in high-income countries, it remains fatal for many in the global south, where early detection and access to treatment are limited. 6. Esophageal cancer. Killing approximately 540,000 people per year, esophageal cancer is one of the most aggressive malignancies. It has poor survival rates and is frequently diagnosed in its late stages, particularly in parts of China, Iran, and East Africa. 7. Pancreatic cancer. Though it ranks lower in total deaths at around 495,000 per year, pancreatic cancer is one of the most lethal, with a 5-year survival rate below 10%. It is often called a silent killer due to its asymptomatic progression and late-stage discovery. 8. Prostate cancer. With around 375,000 deaths annually, prostate cancer is one of the most common cancers among men. Early-stage prostate cancer has a high survival rate, but outcomes vary significantly depending on geography and healthcare access. 9. Cervical cancer. Causing about 342,000 deaths per year, cervical cancer is almost entirely preventable through HPV vaccination and regular screening. Yet it remains widespread in lower-income countries where such preventive measures are not widely available. 10. Leukemia, all types. Responsible for approximately 311,000 deaths annually, leukemia refers to a group of blood cancers affecting both children and adults. Treatment outcomes vary considerably depending on subtype and access to early care. A tale of inequality and opportunity. What these figures reveal is not only the ferocity of cancer, but also the deep inequalities in outcomes across the world. In high-income countries, widespread screening programs, early detection, and cutting-edge therapies have dramatically improved survival for many cancers. In contrast, resource-limited regions continue to face high mortality from preventable or treatable forms of cancer due to lack of infrastructure, awareness, and political prioritization. For instance, cervical cancer has been virtually eliminated in some high-income nations through vaccination and screening, while it remains a leading killer of women in sub-Saharan Africa and parts of South Asia. Similarly, advances in genomic medicine and immunotherapy are transforming the prognosis of lung and blood cancers, but these treatments remain financially out of reach for many. The road ahead. public health experts stress the need for a global push toward equitable cancer care, with a focus on scaling up early detection and screening programs, expanding access to vaccines, e.g. HPV and hepatitis B, addressing environmental and lifestyle-related risk factors, investing in cancer registries and research in underserved regions. While the absolute numbers are sobering, there is room for optimism. With continued international cooperation, investment, and innovation, many of the world's most fatal cancers could become survivable or even preventable within our lifetimes. Until then, the race continues, not only to cure, but to detect earlier, treat smarter, and care more equally.